Invisible battles, health struggles, you might not see. Meet James, the office entertainer. He always has a joke, a quick-witted comment, or even a silly pun up his sleeve. On the surface, James seems like someone without a care in the world. But James hears something you don't, a never-ending high-pitched buzzing sound. It's not coming from the office AC or his phone. It's inside his head, and it's with him 24/7. Or take Emma, a supermom who seems to juggle it all with ease. She's running errands, cooking meals, and helping her kids with their homework like a pro. But on certain days, bright lights, loud noises, or even stress will trigger excruciating migraines, leaving her bedridden and frustrated. Then there's Sophie. She's 30 and outgoing, but lately she's silently battling symptoms like overwhelming fatigue, mood swings, and night sweats, premature menopause. What do James, Emma, and Sophie have in common? They're dealing with health challenges no one notices. These struggles aren't visible, but they affect their daily lives in ways most people never imagine. Invisible health struggles refer to conditions that don't have obvious outward signs. They are like battles fought in the shadows. These challenges are tricky because they're easy to dismiss or misunderstand. People often mask their symptoms to avoid pity or judgment. And on the outside, they might look fine. But inside, they're navigating a world of discomfort, pain, or emotional hardship. In this video, we'll shine a light on these silent battles, share some examples, and explore ways to build empathy and awareness about these unseen struggles. And yes, we'll keep it engaging, with just the right dash of humor. Let's go back to James, our cheerful office guy with a secret. He's living with tinnitus, a condition where you hear a constant ringing, buzzing, or other phantom sounds in your ears. For James, it's a high-pitched whine that never stops. Imagine having a reminder of the last fire alarm you heard, but it's only in your head, all day, every day. James sometimes jokes about how the buzzing makes him feel like a character in a spy movie, trying to crack secret codes. Humor is his way of coping, but tinnitus isn't a laughing matter. It makes it hard to focus, sleep, or relax. And the kicker? No one else can hear it, so it's easy to assume he's exaggerating or making it up. Tinnitus is incredibly common. Millions of people endure it. Causes range from exposure to loud noises, like concerts or construction sites, to age-related hearing loss or even stress. Yet, it remains misunderstood because it's invisible. Next, Emma. If you ask her kids, she's a superhero. She's always on the go, making sure everyone's taken care of. But here's the thing. Emma has migraines, and they're not just bad headaches. Migraines are intense and can come with sensitivity to light, sound, and smells, as well as nausea and vision disturbances. When a migraine hits, rushing through errands, cooking, or helping the kids feels impossible. Imagine your head throbbing while the sunlight stabbing through your window seems brighter than ever. It's unbearable. Yet, Emma doesn't talk about it much because she doesn't want to seem weak. A common misconception is that migraines are just in your head, but they're not. They're neurological events that can last hours or even days. And ironically, people with chronic migraines often lose count of how many times they've had to hear, "Why don't you just take an aspirin?" Now, let's talk about Sophie. At 35, Sophie is grappling with something unexpected: premature menopause. Menopause before the age of 40 happens to about 1% of women, and it brings with it an exhausting combination of symptoms. Sophie deals with constant fatigue, hot flashes, night sweats, mood swings, and even moments of self-doubt about why this is happening so early. Unfortunately, society paints menopause as something that happens to women in their late 40s or 50s. This stereotype leaves Sophie feeling like she doesn't belong in either group. She's too young to openly commiserate with the women who are also going through it. So, she keeps her struggles to herself, making quips about how her fan has become her best friend during night sweats. Premature menopause is caused by factors like genetics, autoimmune conditions, or surgery, but it's rarely discussed openly. Sophie's journey is a reminder of how stigma and lack of awareness can deepen the isolation of invisible health struggles. While we've focused on James, Emma, and Sophie, they represent just the tip of the iceberg. Millions of people are quietly managing conditions others might not recognize. Chronic pain, body aches and fatigue with no visible cause. Anxiety disorders, persistent mental stress that feels insurmountable. Autoimmune diseases, lupus, rheumatoid arthritis, or celiac disease, among others. Fibromyalgia, widespread pain, sleep problems, and brain fog that are difficult to diagnose. These conditions disrupt lives in ways that aren't immediately obvious. They rob people of their energy, focus, or peace of mind, and require constant adjustments that others rarely see. Visible injuries, like a cast on a broken arm, invite sympathy and support. But when symptoms are invisible, people don't know how to respond, or if they believe it's happening at all. This lack of awareness forces people like James, Emma, and Sophie to push through their daily lives without the understanding or acknowledgement they deserve. There's also the fear of being labeled as lazy, overly sensitive, or attention-seeking. As a result, many people choose silence. Raising awareness about invisible health conditions is about fostering kindness and understanding. You never know what someone silently battles. A small moment of patience, empathy, or curiosity can mean the world to a person who feels unseen. Empathy matters because it challenges stigma. When we educate ourselves and others, we help create a culture where people feel they can share their struggles without fear of judgment. Supporting someone with an invisible health struggle doesn't need grand gestures. Here are a few small but impactful ways you can help. Ask and listen. Something as simple as, "How are you really doing?" can open the door to conversation. Offer support without judgment. Avoid saying dismissive things like, "But you look fine." It invalidates their experience. Be patient. If someone cancels plans or needs extra time, don't assume it's lack of effort. If you're someone fighting a silent battle, know this: you are incredibly strong, even if it doesn't feel that way. Take moments to care for yourself, whether it's through therapy, support groups, mindfulness, or small acts of self-kindness. Letting someone you trust know about your challenges can also be cathartic. There's no shame in speaking up. To wrap up, we all should remember that compassion is a powerful tool. The world would be a brighter, more inclusive place if we paused to consider that the person next to us might be dealing with something we can't see. So, today, take a moment to reach out, understand, and show a bit of extra kindness. If you've ever faced these silent struggles, we'd love to hear your story in the comments. Sharing your experience could help someone else feel less alone. And don't forget, like this video, subscribe, and hit the notification bell so you don't miss more content about real-life health and wellness topics. The first step to change is awareness, and you've already taken that step by being here. Thank you for watching.